how to register the organization, all those things they don't know. So they feel they like, you can say, they face a lot of problem in that. So to resolve those things, and they don't know, because during, if you are starting your practice after MA only, and sometime after MPhil or some other professional course, uh, then also they face a lot of problem, and they don't know in different cases what to do, what are the legal things, and how to record everything. Mm, all those things are there. So this is why I have planned this session. So good, like other people also joined, and there are other people they are trying to join. So they will, as soon as they will join, and they will be a part of this webinar, right? So that is why I have planned this webinar, that is clinical practice webinar for new psychologists and counselors, right? So there are many things that we will discuss in this webinar, you can say. So understanding the transition from theory to clinical practice. So that is one thing, because theoretically you deal many things, but when it comes to the clinical practice or practical aspect of it, then we face lot of problems. And then learn ethical and legal responsibility in clinical settings, develop basic clinical skills for the assessment and case formulations. How to develop those skills, because you cannot develop those things in 1 or 2 days, or in 1 week, even 1 month, or in 1 year. Suppose you are doing your MA, because during MA we do certain kind of internships and all, but that is not sufficient, because sometimes we observe only, or whatever work is given to us, that we do, but we don't know the whole picture of that case and everything. So these are the things that we face during our practice. So gain, and when you work with that, then you gain confidence, and in client interaction with therapeutic boundaries. Understand, so we should understand the different boundaries and all, what to do, what not to do, and understand why the supervision is important, that we will learn in this webinar, right? Messes. Okay. Sorry. So this is what, like, we are doing. So, and so these are the things that we will learn in this. So what is clinical practice? So what is clinical practice, that we have to understand. So clinical practice refers to the professional application of psychological knowledge, skill, and ethical principles to understand, assess, prevent, and treat mental, emotional, and behavioral problems in individuals, uh, couples, families, or group. In simple terms, clinical practices where theory meets real human being. So these are the few theoretical things discussed, like to have that background. I am just telling you these things, and that we will cover very fast. And when we'll come to the practical aspects of those things, then only we will you can say, we'll discuss, and we'll take the questions also, right? And I will take the questions after some time when I'll check the chat box, because when I'm taking this, then I won't be able to see these, you can say, messages. So I'll take 1 minute. So key elements of clinical practice. Sorry for these disturbances. So I'll try not to disturb you people again. So this like key element of clinical practice is like assessment, diagnosis, intervention, prevention and promotion, and evaluation. So basically how you will assess your client, sometime it is like when you say assessment. So assessment is, we consider that only the psychological testing. It is not like that. Taking case states, observations, taking information from like people who come with those those persons. So all those things comes under assessment. And diagnosis, like apply, usually we use ICD 10, now it is ICD 11. So there are classification system that we use. So an intervention, kind of like, that should be evidence based. And many times it happens till diagnosis, sometime we learn, but when it comes to the intervention, for 1 hour, after 1 or 2 session, we are not able to handle the client, and then they get dropped. So that happens, so that we have to take care of those things also. So prevention and promotion, because when you are establishing your like practice, or you are working in the field of psychology, so you have to promote also, like promote and preventive measures you have to take, like how you will prevent certain kinds of difficulties and all. And the promotion of your field, because when you promote, you also get clients also. So we'll talk about briefly, we'll talk about that. And evaluation, how your client is is performing, that is also comes under evaluation. Then like what clinical practice is not, because many times there are many people, they say like they are counselor, they can practice, they know everything, but that is not a clinical practice actually, or counseling practice. So it is not giving advice on personal opinion. That is very very big problem. You will meet people, they will say you that I know everything, I have helped many people, and I know the counseling, but I don't have any degree in that. So that is not a counseling. It is not casual listening or informal support, just like your friends and other people do. That is not a counseling thing. It is not practicing beyond one's training, competence, and ethical limits. So you are not trained in that, and you are doing that. So there is always a risk to harm the client. And so training and competence is, you can say, is required for this field. And core foundation of clinical practice is like scientific knowledge you should have, ethical responsibility you have, like confidentiality, informed consent, you know many things of that. But how to implement in a practical manner, that we are sometimes not aware, that I see when I train new psychologists. And then professional skills, like communication, empathy, assessment, intervention. So everything should be like well defined. And recorded, because that is the safety for your client as well as for you also. So self awareness and supervision. So if you are not, many times what happens is you are not aware about yourself, but you are doing the counseling. Like the people, you will say, "Okay, I have faced lot of problems in my life, that is why I can understand other people in a better manner." Right, so that is uh, then there is a risk that like you will not empathize with your client. Basically you will sympathize with them, and you may have also problem in that. So if we talk about in Indian context, so there are legal requirements that many of us know, ethical guidelines of from different organizations, and usually we follow APA, or and there in India we have Indian Association of Clinical Psychology, and there are regulatory frameworks like RCI, and now National Allied Health Bill, like that has like passed few years back. So for other psychologists and counselor, there is a regulatory framework. So clinical practice is not just what you do with clients; it is how responsibly, ethically, and competently you do it. So it is not only about कि आप क्लाइंट के साथ क्या कर रहे हैं, बट इट इज ऑल्सो अबाउट योर इथिकल एंड your competence, your responsibility towards your client, and difference between, like that we have to understand what is the difference between academic psychology and applied psychology, because there is a lot of debate and confusion, and as well as sometimes we face different kind of allegations on each other between academic and applied clinical works, because the people who are from academics, they think that they can do practice. Why they are not getting the RCA license or any these kind of licensing system? So there is a difference, because in academic psychology you focus on theoretical knowledge and research, and in applied clinical work, practical application of psychological knowledge. How you, suppose you know the learning theories, but how you implement in a school or with children or with adult, that is more important. So that is not a part of academic psychology, that is a part of clinical work. And the clinical work you can learn only when you are dealing with real clients, not you are just reading and you will learn. That will not happen. That will not uh, happen. uh, like that will, you can say, never happen, that kind of thing. Because understanding that way, suppose suppose you want to learn the this car driving, right, or bicycle driving or bike driving. So it never matters how much theoretically you know about cars or bike, until unless you will not drive, you will not learn, right? So this is the similar thing here when it comes to academic and applied psychology. So concerned with understanding behavior and mental process, concerned with reducing distress and improving functioning. So goal is different. They understand, I know, and they develop theoretical model and everything. And the clinical work is basically reducing distress and improving your functioning, the client's functioning, basically. So conducted mainly in classroom, universities, and research settings, academic psychology, and this applied work happens in clinic, hospitals, rehabilitation centers, NGOs, and private practice. So that is the difference. Other differences are like the emphasis on lecture, exam, and assignment, and research papers on academic psychology. And when it comes to clinical work, it is about client interaction, assessment, intervention, and follow-ups. So that is the difference, because sometimes we don't know, because we understand like we have done research or we have given exams and all, so we know everything. You may know, but theoretically, not practically, because as I said, what the difference between like learning about car and driving car is a different thing. So objective is knowledge generation and dissemination, and objective is healing, support, and behavioral changes. So that is another difference. And then hypothetical or controlled cases, because when we are discussing cases in the classroom, they are hypothetical cases. Okay, and when we are dealing with the real clients, so you learn, you can say, that is a hands-on training. You have clients, you are dealing with that, and under the supervision of your seniors, basically supervisors, and they are guiding you what to do. Because the everything that is written in the book, or this you understand like this, I suppose the depression's definition of depression and the symptoms of depression that is written in the book will not be like, you can say similarly you will not get in your client, because when you are dealing with human being, that is a more complex part, and there are number of things that affect our behavior. That is why dealing with human behavior is a very difficult thing. So ethical focus in only research ethics, and ethical focus is client welfare, confidentiality, boundaries, and legal responsibilities. So in academics, basically research ethics की हम बात करते हैं. You know that in every university there is a ethical committee and all. You have to take the you can say clearance of that. But when it comes to the clinical setting or counseling setting, so clients welfare, confidentiality, boundaries, legal responsibility, that becomes more important, because if you are not aware about that, you will create a problem for your client as well as for yourself also. And errors of like errors affects grades and research outcomes. Errors can directly affect the client, so see the responsibility in clinical field or counseling field. uh, when if you are not um, dealing with your client properly, it can directly affect the mental health of your client. In research, like in academics, the research outcome and other things will be affected. So key shift from academic to clinical work है, from answering questions to asking right therapeutic questions. And from memorizing theories to using theories flexibly. Because as I said, there is you can say things that you will never learn from books, right? So because I'll again take the example of learning driving car or bike, because they can tell you ki where is clutch, where is your brake, how to balance the like bike, or how to use the steering in car. But they will never you will never learn what to do when there are two cars side by side and you are in between, or someone is coming from front like very fast, how to brake, how much to brake. That you cannot learn. That only you will learn only by practice, only by dealing with real situation, only by driving on roads and highways. So that is the thing, that is the difference between practical and the academic psychology. So from evaluation by exam to evaluation by client outcome, हमारा client कितना ठीक हो रहा है, that becomes that becomes our outcome, not our exams or numbers. From personal opinion to evidence based practice. In, you can say, you may have certain kind of opinion about certain theories, like there is a theory, psychoanalytic theory like Freud's theory, and you are basically you can criticize that, you can evaluate that. But when it comes to the patient, so you have to tell the client and you have to justify why you are using this therapy, how much it is useful in particular case, that you have to respond. Because suppose there is some legal case, so people may ask you or court may ask you why you have used these kind of things. And so that is important. So academic psychology teaches you what and why, and applied clinical teaches you how and with whom. That is the difference. कि क्या करना है, किसके साथ करना है, that is becomes more important. So role and responsibility of psychological counselors, many of you know about these things, but briefly we will talk about that. That psychologists and counselors play crucial role in promoting mental health, elevating psychological distress, and supporting personal growth. Their work is guided by professional competence in ethics and client welfare. Core rules क्या हैं यहाँ पे? Assessment and understanding. So now gradually we are coming to like what is the work of counselor and psychologist. To conduct psychological assessment using interviews, observations, standardized tool, understand the client's emotional, cognitive, and behavioral social functioning, basically how they are feeling emotionally, what is in their mind, how they are behaving, how much they are active in social life and personal life, identify strengths, resources, and areas of concerns, what are the areas that is affecting them more, and then accordingly intervening them. So providing counseling and psychotherapy using evidence-based approaches, like who are proved to be you can say beneficial in those cases. That is what evidence based approaches. So it is not like if you talk in India, basically if you talk to anyone and you have any problem, so everyone will give you some other advice, and sometimes you will be confused. Like you see in you watch reels on Instagram or shorts on YouTube, so you will see for the same problem everyone is giving the different solutions, and person is confused because everyone giving their own opinions. So we are not we will not go by the opinions, we will go by the research and the evidence based therapies. So help clients developing coping skills inside and adaptive behaviors, how they can adjust, support client during crisis transition, and when there are life stressors. So prevention and mental health promote. So it is not only about treating, how they can prevent themselves so that that problem never happen again, or we can minimize the possibility of that. And how resilience means that thing only, how they become more resilient, and they can face the similar challenge in more appropriate way. To conduct psychoeducation programs, workshops, awareness sessions, that is also like our, because if you will not promote your field, other people come in. That is what happening. If you will see on social media, a lot of psychological content is there, but nobody is there to verify that, and there are very few people who are trained in that. So work towards early identification and prevention of mental health problems, so that if you create problem, when you create awareness, so people get aware, they can identify early, and they can be treated at earlier stages. Right. So referral cooperation, sometime what happens is we are not competent enough. Suppose I am a clinical psychologist and there is a client uh, that is having some neurological problem with with psychological issues also. So if I am not able to handle that person, I'll refer to that. And similarly, if that client is in need of, you can say, cognitive therapy, and I'm not in a cognitive, I am not in a position, or I am not trained into that, so I should refer that thing. So referral is very important. And sometimes we become skeptical to refer ki client chala jayega, how I will get new clients and all. So there are many people I know, I have seen when the client comes to us, they don't refer. They basically you can say they keep providing like counseling and all. It is actually not a counseling, but they keep providing that, and till client decide to left. So that is a problem. So we have to be like uh, understand that client's welfare is more important. If you are referring your client to right person, it will increase your practice, not decrease. But we have our own fears, and you can say problems, or you can say we are skeptical about referring the clients. So that should not be there. Documentation record, that is very important. Maintaining accurate confidential clinical records is very important, because you don't know which client will land up in courts, or in any legal system, or some uh, police cases and all. Because suppose you were doing counseling with some person, and that person commit suicide, so definitely people will see the records and everything, and they will ask your credentials, they will ask what you did. So that becomes more important. That is, record keeping is very important. And this, and as a like, you can say, uh, Indian, we are very poor in keeping records. There are few people only, they keep records. Like client come and you take counseling session and you don't prepare any record for that. So this is recommended. You should go for the like detailed record, and what you did with the client, that is more important. Because what happens is legal system, suppose someone is coming to you, and you are and that person, next day that person like commit suicide, then definitely people and legal system will ask you. And there is always a tendency of family, they will blame you. like what you did. So it is not about, you cannot guarantee anyone that they will not do any harmful thing, or like they will not commit the suicide and all. But what legal system usually see, that what you did. So it is like, if a doctor is performing certain kind of surgery on a patient, so is he or she is performing right, um, you can say, those surgeries rightly or not. That is more, procedure is more important, I can say. uh, it is not about the person will, that person will like survive or not, because before doing the surgery they will, all the paper will be signed by the client and the family member. If there is a risk, even if it not a risk, they will uh, like say that sign the paper, then only they can perform surgery. So this is the legal requirement. So it is not about like clients will not do any kind of harm to themselves or others. It is about what procedure you followed, and you record that. So if you have done every step right, then nobody will question you. They will ask you, you will, and they will get satisfied. But if you will not maintain the data, even if you are doing the right work, nobody will listen you. Legal system will not listen you. So that is the thing. We have to aware about that. Professional development. So we should learn, because new knowledge like that come up, and new techniques will come up. So we have to engage in continuous learning. Second is seek supervision. Like at this stage, after 20 years also, if I face any kind of problem in dealing with any kind, because that may happen, because there is a variety of people, variety of situations. So I take the help of our seniors, our batchmates, other doctors, so other clinical psychologists. So there is no harm into that, because sometimes, because of our own thinking that what people will think about me or something like that, we don't seek supervision. So seeking supervision not a is not a problem. So stay updated with ethical guidelines and best practices. Like so we have to update ourselves about ethical things. So, what are the key responsibilities? As I discussed till now, like ethical responsibility, I'm not going into that detail, because that we have already discussed many things like informed consents. You have professional boundaries. Professional boundaries, like I'll talk about bit. Professional about that professional boundaries, because sometimes what happens is you are taking session is of 45 minutes, and you are taking the session of 1.5 hours, right? That is not right. It means you, there is something wrong, because this is a professional relationship. Another thing is like you are taking sessions, and in the evening you are going for coffee and all with your client. It happens. I know many like people, and even my students, they did these kind of mistakes, and sometimes they get into the problem. So that kind of boundaries should be maintained. Some I have seen many people, they are taking financial and emotional advantages of the client. That is not recommended. And though in India laws are not that much strict, but if you will see US, UK, and other countries, many people, they lost their license because of those things. Because as a psychologist, we are basically dealing with emotions. So we are also human beings. So we have to identify. Sometime it may happen like you may get involved with your client, or you take their, that kind of things may be there. So we have to be very careful and aware about that thing, basically about ourselves. Avoid dual relationship and conflict of interest. Sometimes what happens, like your family members, your friends, they may ask, and they can come to you for counseling on online. If you are not able to deal with that, please avoid that, refer them to some other person. Competence and scope of practice. Practice only within one's your training and qualification and experience, because that if you will not that, you will not justify your work, as well as you may get into legal problems also. Avoid design diagnosis and intervention beyond authorization. What if जिसके लिए आप like authorized हैं, that thing you should do, not any other thing. Like if I see many people, the people who are psychologists, they are doing some Reiki or some other things. Do any one thing. I'm not opposing anything, and they are also doing astrology and everything. That kind of thing is they are doing. So do only one thing, and when it is not working, they are saying, I'm psychologist, I'm counselor, I will do that or this that. These things, so don't do that. Expert, like learn expertise and then work in that area, है ना? And be honest about your you can say your limitations also, and your expertise. So legal responsibility: follow appropriate applicable law, regulatory guidelines, handle records, reports, and referrals. Already we talked about. Take appropriate action in cases of risk. Responsibility of self practice. Practice self care to prevent burnout. Sometimes it happens like you are dealing with the clients, and uh, you are into like you are having a lot of clients, and you get into that problem, you are in a stress, or there is a burnout because you cannot listen throughout the day, or 10, 15, 20 cases per day, and not, it will not be like you can say advisable for you and for your client also, है ना? And when there is some risky case, so where you have to inform whom to inform, that you should know. Responsibility of self is very important, है ना? So your health and mental health is also similarly a response important as like your client. So understand that thing, and um, you, and practice that thing. So, psychologist or counselor is not just a helper, but a trained, ethical, and accountable person. Understand this thing. Many people they don't understand. They primer because now sometimes they think even psychology student ki karna hi kya hai? We should only talk and listen to the person, and whatever they think they provide that advice. But that is not a counseling. The primary responsibility of a psychologist or counselor is not to have all answer, but to act ethically, competently in the best interest of your client. Scope of practice in India, there are like RCI body, ethical bodies, and then as I said, like allied health professional bill. They are also registering the professionals, so you can go to their site if you are not a clinical psychology from clinical psychology or rehabilitation psychology field. If you are from other like counseling and other things, then they are creating a register, so you can go there and you can register as a professional using your Aadhaar card. So that is there. So. Uh, in India, if you talk about clinical practice and all, only the RCI is there, you can say. So they provide some training standards, curriculum, licensing and registration, and professional conduct. Who can conduct the psychological assessment and provide psychotherapy, who can do counseling, all those things. So they are the people are like you can say Indian government also they are regularizing many things. Uh, so counselors, counseling psychologists, and mental health professionals without RCA registration can provide counseling and supportive psychotherapy, work on adjustment issues, stress, relationship, academic, and career concerns. We do because now there are a lot of schools, NGOs, they appoint them, right? And now, if you know, UGC also given certain guidelines. They are asking for you can say opinion about that. You can go to the UGC site, and there is a I think 30-40 page document how to like take care of mental health of a higher education institutions. Yesterday only I got the mail from our authorities. So there is also opportunity for us as a psychologist, so that you can that thing you can also check. And they cannot provide formal clinical diagnosis, conduct psychometric testing, like I'm talking about these psychological other counselors and the psychologists, and issue medical legal psychological report, and represent themselves as a clinical psychologist. So this is not advisable. And limits of competence means like professional must practice only within their education, training, and supervised experiences. Avoid working with severe psychopathologists if you are a counselor. And as I said, if you feel any kind of problems, just refer them. like people who are suicidal, psychosis, substance dependence, because that can be a problem for you and for the client also. They can harm themselves or others. Seek supervision and refer when a case exceeds their skills, ethical dilemma arise, clinical client safety is at risk. So, the basic guideline is, if the client is, you can say, person is harmful for oneself or others, then you have to refer, right? If there is any ethical dilemma, please consult your supervisor, your teachers, your seniors, your batchmates. So to try to find out the proper supervision in that. And sometimes we think we'll ask, so that is our weakness. No, it is not a weakness. It's still, I said, after 20 years of practice also, till date, I seek supervision from my teachers, my like batchmates, other thing, because they are good in certain areas, I am good in certain areas. So it is always good to take advice and supervision. Initially it is definitely is required, but afterward also, we need that kind of support system. Online practice in India, that we, because that is trending now, so many of us do using different platforms, or we create our own platforms using the like technologies like this. So we must follow ethical guidelines for telemental health. So there are different guidelines you have to check before, because I'm not going into that much details, because this the objective of this webinar is different. And ensure informed consent, data privacy, clear emergency protocol. Suppose someone is calling you and saying, I am committing suicide, what you will do? Because the person has called you, now you are responsible as a professional, so you have to be very careful whom to like how you will identify that client, whom to call, all those things. So scope of practice remains the same online as offline, so बाकी चीजें similar रहती हैं. So confidentiality is an issue, we know that, so we have to maintain the confidentiality except when there is a harm for self or others, है ना? If there is a case of child abuse, है ना, in a case where the person get like harmed by others, like vulnerable individuals, and if there is a some court order or legal requirements. So in those cases, you can, yeah, like you have to share the information, otherwise you have to maintain the confidentiality. I'm not going much detail, because I know that most of us know all these things, and you can go through again. So informed consent is very important, है ना? Like if there is a minor child, then you have to take you can say this consent from the parent, and it is an adult, then you can tell them properly what kind of therapy and everything you are going to involve the person with. And then many times it happens, people say they take fee and they don't like return, or it is not worth it, or charging much, or all those things. So whatever is there, just like you have to inform ki what is your fee, how much time you will give to them, how you will maintain that, or what they are supposed to do, what you will do, everything you can tell them. And it is an ongoing process. Suppose something is coming up, then also you have, suppose you have to do the assessment, then you have to inform them why you are doing this assessment, how it will help in the therapy and all. So it is an ongoing process, right? It is not like कि एक बार बता दिया and खत्म हो गया. It is not like. And beneficence, not malfeasance. So means कि you can say कि it is always important to promote the well-being of your client. If there is anything that can harm the client, then you have to Hello. I think there was some issue with the internet. So, am I audible? Can anybody respond in chat? Yes. Okay. So we'll start from there only. I'm again sharing my screen, entire screen. Okay. And side by side, you can write your questions there. So in between, I will take uh, that your questions also. So benefits and that we have already completed. And the next one is professional boundaries. So as I said, we have to avoid dual relationships, maintaining appropriate emotional distance, because if we'll get involved, that will be a problem for client and for ourselves also. And no romantic sexual and exploitative relationships that happens. I know many of uh, my students also, like there are not many, few one, but it happens. Clear boundaries regarding time, money and communication. Why it is important, clear boundaries for time? Because if you are spending more than 45 minutes, maximum 1 hour you can say, then it is not a counseling, it is something, because you're talking about other things like relationships, family, movies and all. Then some understand that it is, if you feel like talking to your client, I'm talking uh, from the point of view of the client, then client can do that because they are not aware. But if you are like that, you are like speaking to your client over phone again and again in the evening, night, and not about their problem and all, then it is a sign that you are getting involved with your client. And we are human beings, that happens. So we have to be careful, we have to be aware. When you are aware, then you can avoid those things. If you're not aware, then it is a problem. So online practice boundaries: no personal social media interaction with client, professional communication changes channels only. So if you are d- talking to them on like WhatsApp or chat, you are chatting with them on Facebook chat or some other platform. So it is not a professional relationship. Understand that, and it happens. It Ethics are not rules to restrict practice; they are safeguards that protect trust, dignity, and healing. So ethics are basically for both of us, like for us and for our client. So confidentiality basically build trust, informed consent ensures autonomy, and beneficence and non-malfeasance ensures safety, boundaries ensures professional integrity. Handling ethical dilemmas, agar there are some kind of ethical dilemmas, so then we have to deal with them. How you can deal with, like client safety and confidentiality? The safety is more important than confidentiality. Already we studied that thing, and we know that if there is a risk for others or risk for the client, then definitely you have to um, involve the authorities also. And in case of uh, uh, these kind of situation, when you are practicing, you should have different numbers and referrals, list of uh, referrals, like where you can refer and all, whom to call. You have to maintain that diary also, suppose, and that case, so that you can refer them or you can inform authorities immediately, because that is your responsibility. Working beyond competence, कि a counselor start therapy with a client experiencing psychotic symptoms, so then it is a problem. So desire to help versus limit of competence. Maybe you are being a good person, being a good counselor, being a good human being, basically. Uh, you desire to help your client, but you are not competent in that area, so you will not do that. I know many people, many psychologists earlier. Nowadays, it is less. Uh, they started writing medicine because they worked with psychiatrists and neurologists. They know this is antidepressant. I also know like what is antidepressant and antipsychotics and all. So, but it doesn't mean that, because there are other things also. So you cannot prescribe that medications because you want to help that client, because then that can harm that person, because you don't know the whole picture of how medicines works and everything. So acknowledge limitations, refer to clinical psychologist, psychiatrist, as if you are a counselor and you are dealing and there is some severe case, because there is no boundary today, which is only stress. that can convert into psychosis, or maybe severe depression, or that person may be a suicidal or something. So there is no boundaries of intensities. So client will come to you as a counselor, as a clinical psychologist. You have to decide where to refer. I am ask the question, am I like like competent enough to deal with those kind of things. है ना? So offer supportive counseling only if appropriate and supervised. Dual relationships, जैसे मैंने बोला कि अगर आपका कोई relatives है, friends हैं, है ना, तो try to avoid, because when there are dual relationship, है ना, तो refer, it is better to refer to other professionals. And because in our Indian families we listen कि you are a doctor, why you are referring to others, because being a medical doctor and being a psychologist or counselor is a different thing, because uh, there is a emotional bonding between in social relationships or family relationships. Sometimes it is difficult to deal with them. So legal aspect in clinical practice in India, already we have discussed, like maintain clear, accurate and confidential record, and intake details, consent forms, session notes. One more thing I want to add, records, because nowadays we are using lot of these devices, electronic devices. So don't record without consent. Even you know that even if you're recording someone's phone, right, phone call, that is also unethical and illegal. Because that is why what happens is, if you have noticed, nowadays, like these phones and all, they have given the facility of recording the call, right? So as soon as you start the call, other person will hear that this call is being recorded, right? And whenever you get any promotional call, or you call to some customer care, so they, if they record, they will announce it beforehand. Otherwise anybody can uh, like file a case against you. So understand this thing, because you never know who is who, and why, with what kind of mentality they are coming to you. So understanding those things is very important. And then referral is very important. Already we have discussed, अगर competence नहीं है, medicine की need है, harm का risk है, then you can refer to nearest government hospital, private hospitals. You should have those list with you when you are practicing. Clients have to the right to inform consent, confidentiality also. We know, respect the dignity, and information about the therapy, discontinue therapy at any time. So I seen many times the people who are not much trained, so they become get. I have seen few people, not much. They they get angry, like, if you not come, what this will happen to you. You will not able to handle. So it is not showing. It is not a good sign. Either you are dependent on your client, right, or you are frustrated that he or she is going, and you will lose something, right? So it is not a good sign. So attachment to your client, or getting monetary benefit, and beyond your professional skills, or you can say beyond a limit, because you will charge for your sessions, but you will not get frustrated, because that is the right of your client. He will decide, he will come to you. He will decide if he don't want to come to you, or she don't want to come to you. So that is why it is important. Online counseling ethics, key ethical, obtain specific informed consent, because online may usually will uh, forget about those things, or we don't do. Privacy and confidentiality, it is not like you are recording and everything. Secure platforms use, and clear session boundaries, establish emergency, because online mein risk ye bhi hai, like they can call you at any time or something like that, so don't do that. Emergency protocols, what will you do? Suppose someone is calling you from some other place, 1,000 kilometer away, and the person is saying he or she is committing suicide. So what you will do? So that, for that also you have to ready ki where you will inform. So that is why taking all the details and everything is very important. And you should know the people, or helpline number. There are helpline numbers of provided by the government and all, so you should uh, have those things with you. And then avoid sessions in public places, casual communication via personal social media, recording session without consent. All these things is very important. Now we are coming to a bit like how we work as a in psychological assessment. And before that, uh, I would like to take questions, because otherwise it will be a very long session.